Okay, good morning again. I'm Joan Cornet, and I am in charge of this roundtable now. The name is mHealth Enablers, and that is a very important panel to explain to us different aspects of mHealth at this very moment. In any case, some of you already have been in the Mobile Congress in Garante, probably. I don't know if everybody, because that is in the event here is part of the Mobile Congress, but is in an innovative way. One day here, tomorrow is in the Garante in Mobile Congress. But one of the things is happening now, and yesterday was there since early morning. A lot of people coming to the Congress are really interested in health. Not only people because they're professionals or because they are patients. No, it's a kind of something there. What is mHealth? And one important thing for us from Mobile Capital and the Competence Center of Health, I am director. One of the things we explain is, or answer the question people say, what is e-health, what is mHealth? It's a mess, no? It's not a mess. E-health, in our view, is ICT inside the healthcare systems. That means, I'm a citizen. I want to use e-prescription for my illnesses. I can go on the streets with a flag. I want that. Can't do anything. Because e-prescription, personal health records, imaging, telemedicine is basically the system. When we talk about mHealth, it's other side of the coin. E-health is very important. It's a key issue. We need that. Without that, we cannot make any progress. But mHealth is the citizens. I can get an app for my diabetes. I can get an app for my wellness. I can have devices monitoring my body. I can do it. Okay? The challenge we have now is how we link the system with my data. That's what I talk about. How we link both. It's not opposite. It's not saying mHealth is, no. It is the same connectivity, but from different points of view, different owners in brackets. Anyway, that's the concept. And what we want these 2 days in Barcelona, in the Mobile Congress in Health and Wellness, is how we can learn more about experiences, about the way we're working, the way we're making research, innovating, and how after these 2 days, all of us, we go back home with new ideas, new friends probably, new contacts, and we create this community capable to help each other to build up a real mHealth at the end of the day to give better services to citizens and for wellness or for illness. Anyway, I'm stopping here. I want to talk more. And I have the pleasure to introduce you Francesc, Dr. García Cuyàs, Director of TicSalut Fundation. At the same time, is the responsible or the coordinator of the whole health system in the health department. Francesc, the floor is yours.
Thank you very much. First of all, I want to thank to Mobile Capital and especially to Professor O'Connor for can stay here with us to share this journey. I try to explain you the personal health record that we know a new name that is La Meva Salut. It's a Catalonian name for the personal health record. No? It's a good name for difficult to explain in English. The technology, it's not good. No va. Este está. First of all, I think about what's the ecosystem of personal health record in Catalonia. And I think that there are 8 things not important around the personal health record. The first of all is the strategic plan. No? We have the personal health record around the strategic plan. This is a plan of the Pla de Salut. No? This is a plan that marks the policy of health in Catalonia. But now, the last month, we approved our government approved the el Pla Mestre de Mobilitat, the master plan of mHealth. That it's the first plan of Europe that tried to put the strategy of mHealth in Catalonia around our system. The second one is the second slide. No, the second point. Yes. The second one is that that we want to try to center all the political and strategic around the citizen, around the patient, mHealth or not mHealth strategy. The accessibility. For our, it's a challenge, no? That to make accessibility that the citizens can access to the personal health record, because if we take a good instrument but it's difficult to access, no? It's impossible to use. Then we explain you some things that we are working about to make usable this access. The second thing is the services. If we have a good instrument and it's possible to access, it's important that the services it's useful for the citizen, for the patient, and this is our real challenge now. But the key of all things is the interoperability. How Joan Cornet says, it's more important for us that the patient can introduce your data, no? For the professionals can look this data. Now, if my patient goes to my hospital, the form that they can show me the data, it's with your mobile. Then the interoperability thinks that it is a key, but to integrate this information in the electronic health record of the professionals of health. One of thing is the marketplace. Marketplace is a development that we are working, that is a space when the professionals of health and the citizens can look for share and health apps for to recommend or for to download for your useful services. And all around there are a new term that I say, MH big data, no? Because I think that the mobile health big data, no? Now the system is prepared to introduce data about the electronic health record to the patient. But we think that in few years there are more important the data introduced from apps than now the data introduced of the electronic health record with the professionals. It will be more important the data introduced with the patients, but now introduced in the health system. And finally, the innovation. No? It's impossible to work without innovation. The next one, please. This is our health plan, the Pla de Salut. This health plan, it's a tool. It's a tool and reference framework from the health and related public activities. The health plans center all the policies around the citizens, around the patients. Next one. And this is the mHealth plan, the master mHealth plan, and we are very happy to introduce in this journey. This is the organisms that participate in this plan. It was the Department of Health, Department of Social Services, Department of Presidency of Catalonia, TicSalut is our assurance, public assurance, Fundation TicSalut, Institut Català de Salut is the biggest provider of health in Catalonia, and the Mobile World Capital was the organism that we tried to define a strategic plan of mHealth in Catalonia. Next one. And excuse me, but I like to change the the presentations the last minute, and the last minute it will be impossible to be introduced in the laptop. No problem. And where is the mHealth plan? What is the mHealth in Catalonia? The mHealth is a space that is in between the health and between the technology, no? And now it's a little space. But we want that this space was increased, no? and to make useful for the patients. We think that the important is not technology. The important is the health, the important is the citizen, the important is the patient, but more important is introduce the technology into the normal process of health, the normal process of the assistential model. We want that the doctors, the nurses can use the technology normally in your day of work. And if we can introduce this technology normally, I think that is the key for use this technology. Next one. And all around the patient. It's impossible to make something if we don't think about the patient. The next. Accessibility, our challenge. We are open the personal health record with certificate, electronic certificate. In this year, we are making a pilot, a proof with a robust user password. And we are very happy that we are working with Mobile World Capital, Orange, GSMA, Morpho, and another partners. But we introduced the electronic certificate in the SIM of the mobile. That this is important for us because it's another kind of things to make more accessible the personal health record. And we are working with biometric systems. Next one. This is a screen of our personal health record. Next one. This is one data only. Yesterday, normally between when we only use electronic certificate, we have 1,000 more or less of accessibility of the personal health record. Yesterday, we have 8,000 of accesses of the personal health record. I think that it is a more interesting thing. Next one. Two data. 66% of the access of personal health record is by user and password share. And one thing that it's curious, that's 85% entry with your laptop, the PC. No? The mobile is until now more uses for entry in the personal health record. I think that this change in this moment. The next one. What services the citizen looks for your personal data, information about other regions of Catalonia, medication plan and reports. It's important the medication plan because we can introduce new drugs, next slide, please. The next slide. Yes, this is a medical plan. We can introduce the drugs, new drugs, and the patient can download this medical plan and print in your house and go to the pharmacy and take the new drugs that the doctor has prescribed. Yeah, next one. We're working in the personal health record out APP integration, online booking, telemonitoring, and another kind of developments. New slide. New slide. And this is the mobility, the marketplace accreditation model of APP that yesterday we explained in the medical college. Next one. And I think that this is the key of the technology that is introduced into one process of health. This is the DRC cancer of colon detection. The patient, la personal health record, and information for the patient. The next one. And Joan tells me that it's important to conclusion that it's possible, that we think that it's if we can integrate mHealth into the process of health, it will be possible that this technology increase. Thank you very much.
Thank you, Francesc. Same problem, but we try to. Thank you very much for this special and very interesting intervention to the García Cuyàs. Now it's time for Giuseppe Busia, General Secretary, Italian Data Protection Authority, Garante per la Protezione dei Dati Personali, Italy. It's another side of the coin, no? How data protection plays in this game. Please.
Thank you very much for the invitation. Thank you very much for dedicating thought about data protection. First of all, I would like to say very briefly that why data protection is important for mHealth. Of course, because it's based on personal data. There are many personal data that are collected because of mobile technologies, implies that a continuous collection of data is done, and there is an Internet of Things, or Internet of People, of Person, of Being, as it was said before, and then there is a lot amount of data that is done. The second point is the type of data that are collected, and I want to stress this point, because there are health data, but also when there are not directly medical data, these data are very sensitive because they are collected in the framework of an health service, we can say. The third point that makes data protection a very basic issue in mobile health is that there are many entities, individuals that exchange the data, works with the personal data, and then they have to collect this data, to process this data very carefully, because this is the basic, the base of the work. And fourth and last point for why the personal data and personal data legislation is important is because there are many purposes using mobile health technologies. There are many purposes that are used, that are achieved, and it's necessary, it is important that individual and user has the possibility to understand exactly what are they used, why they, and in which manner the data are used. There was a public consultation. Last January it was published, it was done by the European Commission, and the result of this consultation was that there is in users but also in stakeholders a big concern, a great need of a strong privacy and security tools, and this is very important. At this regard, taking in mind this point, is important to see, of course, very briefly, which is the legal framework that is applicable to all these technologies. And which is the legal framework is the framework that is important not only in Europe. This legal framework apply to all the apps or everything is in the tools and the tools of the people that live in Europe, but the Europe legislation is important also because there are many countries around the world that are adopting some legislation that are very similar to the European model, especially in South America, but other countries. So it's very important to take care to know this legal framework. And the first, the most important point, I'm sorry, there is the most important point of the legal framework is the need to give a correct information to the user, all the controllers, all the stakeholders, all the operators that use personal data has to give to the user a correct information, and as we said before, as health data is considered an important, a special data, a very sensitive data, there is a need to have a higher level of data protection, and there is a need of explicit consent of the data subject. There is a body under European legal framework that in which all the data protection authority work together to give a common opinion and to apply in a common way the legal framework. And I will show you some opinions that are made by Article 29 Working Party. This is this name, and they underline, highlight the importance to have to respect some important principle using personal data, health personal data. The data minimization principle is important to use the data if there is a real need to use them. And also the data retention has to have a limit, and you have to retain the data only how long is need to achieve the real task of the application. And there are, as I said, many subjects that work on that. Each one of that has to assume his responsibility. And there was a last opinion of last October about Internet of Things, and also in this opinion, the Working Party stressed the need that the user must remain in complete control of their personal data. This is the most important thing of that. There is, I will not be so long because the time is going. There is another directive that is very important about cookies, and also on this field there is a need of consent. And there was a joint survey of all the data protection authority that was done, and was published the result on 17th of February, last February, and we analyzed 4,078 websites. We found that in many cases there is an increase of information given to the user, but there is still a lack of a real concrete information of real concrete a free consent. So I will go ahead because there is a lot of time. I want only to say that sorry, sorry for the slide. Okay, I will conclude only to say that there is a need, a task that is common from the user and from the all this operator that offer mobile apps, mobile health technologies, to work together to give to the users knowledge and awareness about the use of the data, because their data are very important for them, are very important for the person who offers services with them, and they have to create a real trust. And the trust is possible only if there is a real awareness about that. So thank you again for listening to me. Thank you for the invitation.
Thank you, Giuseppe. I think it's very tough thing. It's very long. Could be very long because it's very important. Looks boring, but it's very important for the future of mHealth. We need to be sure in the right thing. We have seen from the healthcare system, we have seen from the regulator, how is the new laws in data protection. Thank you very much. Now it's time to see how the companies, the industry is helping to build up mHealth. Now I have the pleasure to introduce you Mittal Parekh, Senior Director, Product Marketing and Strategy, Globo, United States. The floor is yours.
Can you hear me okay? All right, guys, we have 10 minutes, so we are going to make the best use of this. Spyros and I are from Globo, and we are going to share with you a few use cases on how we have made this possible. So, first of all, thank you very much for inviting us. Couldn't have been happier. Good that you heard from people who are implementing these things. You heard from regulatory compliance guys, and now it's time to hear from us. And we are the enablers, we are the technology providers. We put the underpinning in place such a way that all these things are made possible. So the mere fact that you all are here is that you understand the issues behind enabling healthcare when you throw in mobility in place. Okay. So if we break this down, it's basically three-dimensional problem. There are, on one side, it's IT that wants to ensure that there is enough security, compliance, and control over devices, applications, and most importantly, the data that's being consumed by those applications and data that's being shuttled between those endpoints, those devices, and servers wherever they are, right? The second one is from the end users. So you are the end user of this technology, these mobile apps. There are clinical staff, that's end user, and there are other supporting elements, supporting staff. They are the end users of this mobile applications and devices, apps, and data. Right? From their perspective, what's most important is they would like the best productivity. They would like to remain productive even when they are in the world of mobile devices. They would like to bring their own device. Right? It's freedom of choice. Right? And they want the best end user experience. They do not want the crappy experience that they have been foreseeing, right? They would like to improve when they go mobile. And last but not the least is the regulatory compliance. So if you can relate to terms like HIPAA, terms like DPA, then you know what I'm talking about, right? It's that when you are shuttling data between those devices, those applications, you want to make sure that regulatory bodies are kept happy. So let's go to the next slide, if I know. All right, so let's look at the challenges. I gave you the lay of the land, that there are three constituencies. So think from this perspective. Whenever you have clinical staff bringing their own device, trying to provide the best healthcare experience to patients, using the devices given by their healthcare operators, their hospitals, clinics, or bringing their own devices, they are trying to access real-time information for making sure that patients are served better. End users like you and me, we are trying to use these applications and access our own personal health records. We are trying to do various simple things like scheduling an appointment, reviewing our own test results, right? These are personalized services that we are consuming, right? At every point, we are using these devices, we are using mobile applications and consuming the data that's personally identifiable, though that is a private data. And last but not the least, all these apps are powered by access to healthcare information systems, right? How are we ensuring that access to those information systems, that access is secured, the data is secure, so the pipe is secured, the data traversing the pipe is secured as well, right? So I can go on and on on this one for the whole day. I would rather give it to Spyros and let him share with you at least three use cases, three real-time use cases that addresses these HIPAA, high-tech, and DPA issues that we have solved for our customers. Spyros. Thank you.
Thank you, Mittal. So the next case studies illustrate the challenges that Joan and my other presenters addressed, mainly the connectivity with backend systems and wearable devices, and also how to keep the privacy and confidentiality of data of patients. So let me, So the first case study concerns mobile application for patients. So Embryogenesis is a fertility clinic, is an IVF clinic, and they were quite active in the social media space. But they want to be more, to extend their reach to their patients through a mobile application. So Globo designed and developed a mobile application for both their existing patients and the ones that are still not registered with a clinic. So for the ones that are registered patients, they could have access to the medical history, to their exams, they could see photos and videos of the embryos, they could book appointments, they could get push notifications when an appointment is coming, among other things. For the ones that are not still patients of the clinic, they could have access to some informational content such as the location of the clinic, driving directions, and working hours. Now, the key concern here was not only the security aspect, which means you had to connect securely with the health information system of the clinic and fetch data between the app and the clinic and the backend, but also had to keep the confidentiality of the data. I mean, laws are quite strict, so even for a couple, the husbands do not have access to the wife's data, and vice versa. So Globo's platform provided the encryption and the user authentication necessary to alleviate such issues. These are some screenshots from the mobile application. Now, the next case study is for mobile applications for medical staff. This comes from Australia, so Globo has won a tender with the help of a local partner for the New South Wales healthcare system. That tender concerned the replacement of paper forms used by doctors when they visit their patients with iPads and the necessary mobile applications. So Globo designed again an application, again with the help of a local partner, that mobilized those paper forms. So doctors now could go to their patients with their iPads and they could see the personal health records, they could update them while they are there. And that, of course, avoids going back to the office and then do some data entry to the computer system. So that leaves them more time with the patient. And of course, it alleviates common errors that can happen when you copy from a paper form to a computer system. Again, some screenshots. They could also run some cognitive tests, so they could draw patterns, and all this is updated securely, updating securely the back end of the hospital. And last, it's a European project for managing Parkinson's patients. So Globo is a research partner, and we are covering the mobility aspect of that project. Now, the idea is that you have mobile applications installed in smartphones that connect to wearable devices, so to the wristband of the patient, to insoles of their feet, and also to a smart pillbox. So the caregiver and the clinician can have real-time access to monitor the symptoms of the patient, like motor symptoms, like dyskinesia, gait, imbalance issues, etc. And when the symptoms deteriorate, they can, of course, intervene immediately. Also, they could also have access to if the patient gets the right dosage of the medication, because the pillbox, again, connects via the mobile app to the caregiver and the clinician. So they could see if the patient has taken the medication, the right dosage at the right time. And again, they could take remedial actions. So, so that's it for my part. And again, give back the speech to Mittal to explain a few things about Globo.
Thanks, Spyros. So, guys, I have 1 minute. Here's the thing. You saw how complex it gets very quickly, okay? And you need a very robust technology company to make all these things possible and keep everything humming. So a shameless plug on Globo. Globo is a 17-year-old international leader in mobile enterprise. We are a $100 million a year company listed on London Stock Exchange. We have 2.3 million seats deployed over 50 countries, offices in 7 countries, and most importantly, from a mobile health perspective, we have what it takes in order to ensure security, control, compliance, and data privacy. Most notably, if you realize, we recently got our own FIPS 140-2 encryption certified. That's we can go walk into a healthcare institute, we can prove it to these guys that we have necessary encryption technology to protect the data. And if you look at our customer base, who's who are in our customer, and we are demonstrating at Hall 8.1. Please come and join us there. Thank you.
very much. Time. Fantastic. Good. Time for questions. One question, two questions. Quick. No questions. Thank you.
Don't be shy, guys.
No.
The question is
Wait, for the micro.
Thank you.
Peter.
No, the question is, Michael.
Yes.
Is it your product have any intention to go to China?
Yes. Yes,
Are
it
you in
is.
China already?
It's there. We have.
We have a local partner in China, and we're working for both mobile applications and the mobility in general of the market. So we do have, yes, a presence there.
You do. So what is the penetration level now?
It's still early. I mean, it's still we're still working with a partner to build more case studies in the market.
I see. Okay. Thank you.
No question?
Thank you. This is about the solutions. Now?
Yes, yes.
This is about the solutions you are providing in general. I think that they are very nice and they are addressed to elderly people. However, and especially when I was just walking yesterday in the Mobile World Congress fair, they are providing the solutions in devices and now, for example, in very small clocks. And for example, I can read what is in the small clock. So what about the interfaces you are providing for elderly people? So this mobile phone, it's okay because there are special mobile phones that you can make interface very nice with big buttons. But now it's changing every time, more information with small letters. So what kind of interfaces are you thinking for elderly people?
So let me see if I understood the question well. So you are talking about mobile phones, new age and new set of mobile phones coming in, and how are we including those? Is that the understanding? I didn't quite get the question.
User interface suitable for elderly people.
Understood. So thanks for clarifying. User experience. So we are committed to best end user experience, and when it comes to elderly people, yes, we have technology underpinnings in place in order to enable those. It could be as simple as making sure that numbers are much bigger so that they can see it, versus using technology in order to make our applications more accessible. Indeed.
Another question? Thank you.
Okay, perfect. It's actually the same direction because as patients and patient organizations, we see beautiful devices, but we don't see that, as he said before, a small place to put all your information is not really helpful if, like me, I have 2 new eyes. Right. So this is the smallest I can see, and if my display is already that big, sure, the only thing when you get it into that, it's not helping. So the question was really, do you have anything to make it bigger, slower, in
sure,
different colors, stuff like that? And then you're from your mobile, you need some more extras to get your elderly patients to be able to use it. Did you think about that? Did you use an HTA, for example? Sure. Did you look into an N group of 200 old people that were trying out your material?
Sure. Right. So, indeed, here's the thing. Where you are coming from, what you observed up till now is people are taking last generation of those applications and force fitting onto that small screen, and that's where the problem starts. And when put Globo in the mix, right, we are committed to, as I mentioned, providing the best end user experience. So we have technology that allows you to build those applications that are responsive. If you are using a smaller device, it is going to be way more articulate, and it will be well understood what you are doing. You don't have to pinch or zoom. So we are throw in our technology in the mix, and you are going to see a big difference, a meaningful difference in how you consume the same data entry forms for your healthcare need. Yes, and for that, please drop by our booth and we'll be happy to share with you how we are doing it.
Last question. The last question.
To follow up on the previous two questions, what about voice recognition and using voice? Surely the mobile phone, the best thing about it is you talk to it and it talks back. So why are you forcing people to read things on a small screen when, as these people point out, that's maybe not the best interface?
Sure. So you have to understand that talking to your phone and getting directions is very different compared to talking to your health applications and getting some healthcare directives. Okay, there are a couple of issues with this one. First of all, when you use your phone and talk to Siri, that's not private, that's not protected. And if you want the same experience inside of your mobile applications, yes, we do have technology in place to plug in voice to speech and speech to voice recognition, and we'll be happy to share with you. Drop by the booth. Yes, indeed.
Sorry, last question. Please.
Thank you. Nice presentations. One question. Would you mind to expand a little bit on your business model? So you indicated the different stakeholders in the ecosystem. Who's paying?
Short answer is where it pinches the most. Who's paying? Okay. Let's understand that better. So it could be very well a healthcare service provider. So Spyros shared with you a few case studies where the healthcare provider, the hospital, the clinic was paying for making their services accessible to their patients. Right? There are cases where government is paying for making their services accessible to citizens. Why? Because if you realize, by providing these healthcare initiatives, they are really reducing their cost. They are reducing their overhead when everything is accessible using mobile devices, no matter where you are, what device you have, whether it is offered by your employer, whether it is your own device, it's in everybody's best interest. Does that answer your question?
Thank you very much. After, in the coffee break, we can have more talk to them. That means that they will be able, and we can talk more about detail. I want to thank you, all of you, for this session. Only one little thing before closing the session. When you get out from this building, outside, you will find 2 ambulances and a blood donors bus. Don't worry, it's not an accident, it's nothing wrong. It's only to say we want to stay in the street. And today we introduced to citizens 2 applications, one on emergencies, another one about blood donors. You have interest to look at these 2 amazing applications, go downstairs, not now, and break, and the coffee break or after, and you can see how things are happening for the citizens in the street. Anyway, time is run out. Thank you very much, Francesc, Giuseppe, Mittal, and Spyros, and thank you to you for all questions and listening. Thank you.
Thank you, guys.